Welcome, MedHeads! If you'd like to see more videos, make sure you subscribe and click on the notification bell. Trichinellosis is a parasitic infection commonly caused by the species Trichinella spiralis. Now hold up, what type of worm is Trichinella spiralis? Is it a hookworm, whipworm, pinworm, or roundworm? That's correct. Trichinella is a roundworm. Now, the infection is transmitted in two ways, commonly via ingestion of undercooked meat, usually pork or wild bear meat, which contains the encysted larvae in striated muscle. These animals acquire this infection often from rats and rodents. Another way is from the ingestion of eggs in food or water contaminated with feces. However, this is less likely. Keep in mind, the method of transmission is a commonly asked question in USMLE. Trichinellosis is very common in places like Mexico, Argentina, China, Thailand, and Central Europe. Very often, patients present with the infection after traveling or vacationing in these endemic countries. Following the ingestion of larvae encysted in striated muscle, the larvae is then released by gastric acid and invades the small intestines, developing into adult roundworms. Patients can develop nausea, vomiting, diarrhea, and abdominal pain. This is called the intestinal stage and occurs up to 1 week following ingestion of the encysted larvae. The now adult female roundworms then release larvae that migrate into the striated muscle where they encyst. This is called the muscle stage, where patients develop the classic trichinellosis symptoms such as muscle pain or myositis, periorbital edema or swelling around the eyes, chemosis or swelling of the conjunctiva, conjunctival and retinal hemorrhages, as well as subungual sphincter hemorrhages. Let's jump into a question. 25-year-old female presents to the clinic complaining of difficulty with vision and painful swelling around the eyes for the past 4 days. She has worsening pain in her neck, arm, and leg muscles despite the use of over-the-counter pain relievers. 2 weeks ago, she traveled to Thailand for vacation. 1 week after returning, she developed vomiting, diarrhea, and abdominal pain, which all resolved spontaneously. Her temperature is 101.2 degrees Fahrenheit, blood pressure 120/80, pulse 85 beats per minute. Physical examination reveals periorbital swelling and conjunctival edema with hemorrhages. Reddish-brown discoloration is found under the nail beds. Lung and heart examinations are unremarkable. The lab results reveal the following: creatinine kinase 240, leukocytes 10,700, neutrophils 63%, bands 4%, eosinophils 25%, lymphocytes 22%, monocytes 5%, and erythrocyte sedimentation rate at 75. Which of the following is the most appropriate pharmacotherapy? Mebendazole or albendazole is the drug of choice in treating trichinellosis. From the other options listed, they are all antibacterial medications which are not ideal in treating this parasitic infection. Corticosteroids can also be added to reduce the inflammation. Let's review the vignette. So the vignette describes a patient having visual difficulty and periorbital edema. It also notes the presence of myositis as evidenced by the pain in the muscles and the elevations in creatinine kinase, indicative of muscle inflammation. It also mentions that the patient recently traveled out of the country to Thailand, an endemic region for trichinellosis. It describes the intestinal stage where the patient developed vomiting, diarrhea, and abdominal pain. The elevation in temperature is indicative of an infection. Physical examination is supportive as it reveals periorbital swelling and bilateral conjunctival edema or chemosis, as well as conjunctival hemorrhages. Now the reddish-brown lesions found under the nail beds describes subungual sphincter hemorrhages. Subungual splinter hemorrhages can also be found in endocarditis, so it's very important that you pay attention to the heart examination. In this case, the heart examinations were unremarkable. Now the lab results reveal leukocytosis as well as eosinophilia, which is very indicative of a parasitic infection. An elevated erythrocyte sedimentation rate is also indicative of inflammation. Thank you, MedHeads, so much for watching. If you'd like to provide any additional information for examination purposes, please leave so in the comment section. Don't forget to like, subscribe, and click on the notification bell if you'd like to see more videos. Also, feel free to follow us on our Instagram page at medheads.inc for more questions and daily examination tips.